IVF touches many stakeholders: patients, their offspring, healthcare providers, insurance companies, as well as employers of patients. Each of these groups often primarily focus only on their own immediate concerns and needs, not incorporating how each step and choice along the path are intricately tied to one another. On February 22, 2013, a multidisciplinary panel of experts convened to review the implications and downstream impact of current standards of care in IVF. As key stakeholders in the field of infertility, their unique perspectives on the challenges and opportunities afforded by ongoing advances in IVF addressed the near and long-term issues faced by each group. In the end, the avoidable complications of IVF care may be in the past, and the promise of one healthy embryo and one healthy baby now a reality.
Today, it's really exciting. I am participating in a multidisciplinary panel of some of the leading experts from all over the country to talk about the issue of twins and multiples and whether the field of reproductive medicine is ready to move toward elective single embryo transfers, enabling an infertility patient to take home one healthy baby.
The risks of twinning are underestimated by the general public. Often people think it's something to be celebrated, but it's not always the case. And in my specialty, in maternal fetal medicine, I'm probably biased because I see the downside of it more frequently than another might. The biggest risk with twinning is preterm birth, and preterm birth remains the number one cause of newborn death. It remains the number one cause of newborn morbidity, mortality, and suffering. It eclipses every other problem. It eclipses birth defects. It eclipses everything. So, if there is an intervention that makes sense, that reduces the risk of prematurity of that degree, that's a huge thing for us.
Our intensive care units, neonatal intensive care units, are populated with multiple gestation babies, and great expense to the healthcare system, but great morbidity for those children. And the fact that you could achieve pregnancy with a very low twinning rate is probably one of the biggest breakthroughs from the standpoint of an MFM.
Miscarriages are mostly due to the particular embryo having abnormal genetics. So as you might expect, if the normalcy of eggs declines with age, then the miscarriage rate will kind of go up with age. So there's always been this problem that as women get older, it gets harder to get pregnant, but in our field, there's also a whole lot more miscarriages with age. And every one of those miscarriages kind of sets you back. You can't try again until that miscarriage is resolved. So that's been a problem with just kind of putting back unscreened embryos in older women, because if they get pregnant but it isn't a good one, then you've lost another 3 or 4 months and you're back at the beginning and trying again kind of at the start. So screening embryos gives you a way to kind of avoid that problem of an inadvertent miscarriage.
So the concept of spending less money for better care is obviously at the heart of certainly accountable care, is at the heart of quality improvement, and hopefully as science evolves, it should be, I think, what we all strive for, which is how do you maximize pregnancy success rates and reduce the risk of multiple gestations, and in this case with IVF, reducing twin gestations.
Single embryo transfers time has come, and I really hope that it's implemented for all infertile couples in the nearby future.